Hi guys, my name is Holly for those of you who don't know me, and I'm not really sure where to start with this whole video thing, but I'm having hip surgery 1 week from today. Today is May 6th, 2020. I'm having surgery on my right hip. I have a labral tear in the front of the hip, and I also have a cam type femoroacetabular impingement, so they say. So I kind of want to give a little bit of backstory. Basically, the reason that I'm going to make some of these videos is I had an adult tonsillectomy a few years ago, and I know when I had that surgery done, I watched so many recovery videos just to see, what was, so to speak, normal and where I was at, and it helped me feel better. So as I've been planning for this surgery, I've been watching some videos to see people like myself and kind of what to expect through surgery. So I'm kind of paying back to that more or less. So I decided to make some videos. Honestly, there's not a ton out there for this surgery. So hopefully I'll be able to help somebody in the future. If you end up watching this video, give me a shout out, comment, let me know. It's also kind of cool for family members or friends, anyone who's curious about how I'm doing. I'll also be posting these on my personal Facebook as well, so you can just ignore them if you don't care. But anyways, so a little bit of background. I was a gymnast growing up. I did gymnastics from the age of 3 till like 15. I did it in high school a little bit. I was a cheerleader, active. Always been a runner, just into working out. I was a personal trainer. So anyways, activity has been basically my life. About, I guess, 3 years ago, in the end of summer in 2017, I started getting like pain down my right leg. My back pain was getting worse. I always had kind of a weird back just from gymnastics, but it didn't bother me too much. Just take some ibuprofen, it would get better. I started having some pretty bad pain. I'd throw out my back, that kind of thing. So I started going to a physical therapist for my back, just because I thought that was the best route to go. So I did that for probably 5 months or so. Nothing was really getting better. I was seeing a chiropractor. Luckily, my boyfriend Michael has been with me since then, so he is a chiropractor. So he was able to treat me. It didn't really work. I'm like known as his toughest patient, he likes to say. So I stopped seeing him. I stopped seeing the chiropractor. The physical therapist actually referred me to go see a spine specialist. So I went in, they did x-rays. I ended up getting an MRI. They found lots of stuff. So this was like spring of 2018. They found, just pinched nerves. I have broad-based bulging discs. I mean, nothing that I didn't really know before, but more or less I was curious, like, how are they going to help me? So they couldn't really do much. They ended up doing a steroid injection into my L5, and it did not work. If anything, it was supposed to work for a little while, like help the leg pain, help my back a little bit. It honestly, it didn't do anything. From there, they let that sit for about 2 months just to see how things were going. I went back in, I let them know it didn't work. So then they sent me to acupuncture. Did acupuncture in the spring, summer of 2018. I honestly didn't notice any difference from that either. I didn't really know what it was supposed to be doing, but acupuncture did not work. At this point, I couldn't run. I could barely stand. In between that time, I had to quit my job as a personal trainer. I had to find a desk job, which I now love, but at the time, it was a big switch, all because of this pain that I was dealing with. I went back to physical therapy 2 other times, because it did kind of help a little bit for a while. It didn't hurt. But at the worst, it was through my back. It was wrapping around to the front of my hip. It was going down the leg still, whatever. So anyways, eventually I was going to physical therapy in the fall, a different one in the fall of 2019. And she was actually thinking, you know, I was always told that my hip hurt because of my back. I've never been told that my back hurt because of my hip. So she said, you know, I've noticed that your hip seems, you know, I don't have the mobility that I should. Certain things bother it, that kind of thing. So she actually sent me to a hip specialist where I was able to go in January of 2020. They did x-rays, and right away they were, you know, said that the hip was shaped differently than it should be. That it was rubbing. I'm not really sure. They were showing me on the computer, but I'm not a doctor, so don't listen to what I say as like the Bible or anything. But basically in the front of the hip was shaped different. She said you might have a tear, so we're going to have you see or do an MRI. So they did the MRI. A couple weeks later, lo and behold, I have the labral tear and the cam type impingement. So right away they said, you know, they're not going to force you, and they didn't force me to opt into the surgery, but they said, you know, if I don't do the surgery, that my risk of having to have a complete hip replacement as I grow older gets, you know, higher risk of that, the arthritis. And once I was to develop arthritis in my hip, they're not going to do surgery then. Being young and able to recover, it was something that they want to do sooner rather than later. So I said, okay, you know, sign me up. So my surgery was actually scheduled for March 31st. With all of the COVID-19, it was about a week before the surgery, actually less than a week. It was like 5 days before I got a call from the surgeon herself saying that, you know, the surgery had been postponed indefinitely. So I've just been kind of waiting in limbo right now. They tell me that the recovery can be, I mean, everyone's different. So 6 weeks, 8 weeks, am I going to be able to work? Am I not going to be able to work? When am I going to be able to drive as it's the right hip? Everything's just really up in the air. But they did call me this morning and they said, you know, we can get you in next week. So I have my post-op tomorrow, which is a telehealth appointment. So that should be interesting, or pre-op. And then I actually have to have a COVID-19 test on Monday. So I will go to a drive testing location. I'll get the swab in my nose, get tested for the coronavirus. And then I'll be quarantined for 48 hours until my surgery on Wednesday. So it should be pretty interesting. I plan on posting videos just kind of as things go, hopefully at least once a week. I'd like to do, you know, the day after surgery, just let everyone know how I'm doing. At this point, I'm just kind of preparing myself, trying to go on lots of walks, exercise as much as I can, get healthy food in the house. I have my mom coming down to Madison, Wisconsin, to help and just be here because I'm not going to be able to move very well for a while. I have my boyfriend that's going to be able to assist and help me through this time. So I think right now just figuring out what needs to be done with work and getting, you know, on my leave time, figuring out all the paid time off, that kind of thing. Making sure I have nothing really to worry about once it actually happens. I actually ordered a pregnancy pillow on Amazon that should be here in the next week. I'm hoping it makes it. It's actually scheduled to be delivered on the 13th or 14th right now. So hoping that gets here on the 13th. And yeah, so that's my history. And I guess I'm really hoping, they say that, you know, the surgeon was honest with me. She said that my hip surgery may help my back or it might not. You know, we're going to see what happens, but either way, it's going to hopefully improve my life dramatically. I'm super excited and hopeful for this, and we will just see what happens. Also, I just realized that Hunter's sitting back here, but that's my puppy Hunter. And yeah, I'll keep you all updated as things go on.